On this episode, we will talk about what do we do with the removed portion of stomachs after your sleeve. We'll talk about the anesthesia needed for weight loss surgery, and we'll talk about eating and drinking after weight loss surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 207 of the AskDrA show. Thanks so much for joining us. Hey, and thank you so much for sending me your questions. Really appreciate it. Remember, I am here for you, and if I don't have questions, well, there's no show. So keep bringing in those questions. There's a way we can grab those questions and add them here to the show. And that is if you use the hashtag AskDrA throughout social media, we'll be able to grab those questions if you post them throughout social media, add them here to the list. I'll be more than happy to be here for you to answer them. And also, if you're interested in weight loss surgery, gastric sleeve, do me a big favor, go ahead and hit that subscribe button. That way you don't miss any of our future videos as well. So let's get into the show. All right, so this is a very common question of what do we actually do with those portions of stomachs that we remove? And I'm going to answer this. This is a joke, all right? So this is something that I sometimes say to some patients that come in, and I sense they're in a good sense of humor, and I tell them, well, you know, we have this good alliance with companies abroad. We send those stomachs to Europe, and then they work on them. And at this time, you see the patient, they're like getting curious, and they don't know what to expect on my answer, and I keep going, you know, and make it interesting. And these companies, they receive the stomachs, they start working, and well, they start crafting things out of them, and you can see their faces just change and flip. And then I say, well, you probably heard about these companies. It's like Gucci and Prada and Louis Vuitton, and they're like, and then they break the laugh, you know. So, of course, that's the joke. But the truth is, what we actually do with stomachs is those stomachs are sent over to pathology. They are examined under a microscope just to make sure there's nothing wrong. This is just a routine thing we have to do. At least in our neck of the woods, it's something that is, it has to be done with anything that's removed from the body. It has to be examined. It has to go through pathology. And after that, then they're examined, they get incinerated. So that really is the truth. But anyway, I think the first story is a little bit more interesting. All right, second question is, can you explain a little bit of what type of anesthesia is needed or is used for weight loss surgery? And since weight loss surgery is done through minimum invasive surgery nowadays, I mean, pretty much around the world, we use laparoscopic technique, which means we don't open patients up. Pretty much around the world, general anesthesia is used. Although there are some inhaled gases that are used for general anesthesia that have a very high affinity, especially for general surgery or any other type of surgery that's not bariatric surgery. And that gas has a very high affinity toward fat deposits. Of course, when we're doing weight loss surgery, well, we have patients that have fat deposits. So we use a different type of gas that does not stick to fat cells, does not stick to fat deposits. That way it doesn't stick along to you for long periods of time, and you spring back up when it's time to wake up again. That is the type of anesthesia we use this here at our center, because this is something that we do and we focus on every single day, several times a day, and this is what we do. All right, and the last question is drinking and eating at the same time. We strongly suggest the first few months after your surgery, you try to avoid drinking and eating, or drinking while you're eating the first few months after your surgery. And the correct, or the way the question was made was, can I do this down the road? The answer is yes. You will be at a certain point be able to drink while you're eating. The reason we suggest you don't drink while you're eating is because the sleeve is a narrow tube, and while you're eating, the solid food starts to pile down and start to come up. And when you drink and you pour fluids into that funnel, because it acts like a funnel because there's an exit to it, that liquid goes down, the solid goes up, and that switch of the liquid with the solid creates an uncomfortable sensation to the patient. And that's something just we want to avoid on a patient, just want to avoid that uncomfortable sensation. Not that you'll be able to hurt your sleeve, not that you'll be able to damage your sleeve, nothing will happen. You'll be fine. It's just a matter of, it's important to avoid that uncomfortable sensation. Now, down the road, once you have healed, once the swollen tissue has come down, you'll be able to enjoy a sip or two of your fluid, your liquid, your water, whatever you decide to drink while you're eating, all right? But the first few months, maybe 4 to 6 months, I would suggest you don't drink while you're eating, and wait at least once you're done, and then afterwards restart the drinking. But down the road, not a problem. All right, so there you have it. That is it for episode 207 of the Ask Dr. A Show. Thanks so much for joining us. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Hey, don't forget to subscribe. Leave me one of these. Very useful. Thank you very much. I'll see you next time.